Next comes the priority 2, means urgent, which should be addressed within 15 minutes. And you ask the patient, does the patient or the fetus have urgent or the priority 2 vital signs? Which means that she is having heart rate of less than 50 or more than 120 beats per minute, respiratory rate of less than 12 or more than 26, oxygen saturation of less than 95%, blood pressure is more than or equal to 140 by 90 mm of mercury symptomatic, or less than 80 over 40 on repeated checkup, and the fetal heart sounds are more than 160 for more than 60 seconds and decelerations. Number 2, if the patient is in severe pain without complaint of contractions. It means that severe pain unrelated to contractions more than or equal to 7 on a 0 to 10 pain scale. Or is this a high risk situation, and what are those high risk situations? In case of maternal, altered mental state, suicidal or homicidal, recent trauma, unstable, high risk medical conditions, difficult breathing, fetal conditions complain of decreased fetal movements, active vaginal bleeding which is not spotting or show, or less than 34 weeks and having complaints of or detectable uterine contractions, spontaneous rupture of membranes, leaking or spotting, or more than 34 weeks with regular uterine contractions or spontaneous rupture of membranes, leaking, with any of the following conditions. And what are those conditions? She is having multiple gestation, placenta previa, HIV, or she is having planned medically indicated cesarean section due to maternal or fetal indications, and breach or malpresentation. And the next condition in priority 2 comes, will this female and or newborn require a higher level of care than institution provides? Means clinical indication of the female and or newborn of transfer per hospital policy. In all these conditions, patient should be checked on urgent basis and comes under the priority 2 level, means that she should be addressed within 15 minutes.